Most people that come to us always say that thyroid disorders do not happen in children. They are very, very common in old people. This is not a disorder of children. And they get really shocked when they come to us with a newborn with thyroid disorders. Thyroid disorders can occur at any age group, right from birth to an elderly individual, but the most important effect of thyroid deficiency is in fact in the newborn period. Thyroid is a major regulator of brain development, and the maximum brain development of a child happens within the first 2 years and particularly in the first 2 months. So a delayed diagnosis of congenital hypothyroidism or thyroid disorder right from birth could lead to significant impact in terms of long-term intellectual outcome. Congenital hypothyroidism is common. Every 1 in 1500 child in India suffers from congenital hypothyroidism, and according to estimates, every year we have 30,000 children who are born with congenital hypothyroidism. Unfortunately, the diagnosis is not made in most of these individuals, resulting in delayed diagnosis and impact in terms of their mental outcome. Congenital hypothyroidism is the most common treatable cause of mental retardation, and if we want to achieve good and healthy childhood, we should do screening for newborns with congenital hypothyroidism. Most countries across the world do a neonatal screening. Unfortunately, we don't have facilities available for that in India. The test is very easily available. It's not very expensive. It costs around 150 rupees, can be done easily, and the result will come immediately, and this can have a huge impact in the overall growth and development of the child. Unfortunately, despite so many advances in terms of diagnostics and treatment, we pediatric endocrinologists still see children who are born with congenital hypothyroidism at a very late stage, which has huge impact in terms of their growth and development. I have, for example, seen children who come to us at around 18 years of age with extreme short stature, who look like a 3-year-old, who have no mental development. So if you want to avoid these, screening for congenital hypothyroidism is absolutely important. The fetus produces very small amount of thyroid hormone. By around 14 to 15 weeks of gestation, the thyroid gland, the pituitary, the hypothalamus matures, and it starts to produce the thyroid hormone. The production amount of thyroid hormone, however, is much lower compared to adults, and most of the thyroid hormone that the fetus is getting is actually coming from the mother through the placenta. The thyroid hormone T4, that is tetraiodothyronine, and T3 iodothyronine can cross the placenta to the tune of approximately 40%. And this 40% hormone is sufficient to provide the thyroid required for the newborn. So it's very, very important to keep the mother's thyroid hormone at the right level to ensure that there is a good development and brain growth of the newborn. The maternal thyroid hormone is sufficient to maintain the thyroid levels in the first 2 weeks of life, but subsequent to that, if the baby is not producing thyroid hormone, there would be deficiency of thyroid hormone, resulting in impact on brain development. If we start treatment in a newborn within the first 14 days of life, we can achieve a very good outcome. Every week that we are delaying, we are impacting the IQ points of a child. So if a child is treated at a late age, we might be able to start the treatment to improve the symptoms, but the long-term impact on the brain development, on intellectual development, on language and other parameters may be there. It is therefore absolutely essential to identify and start treatment of somebody who has got thyroid disorder by around 14 days of life. Even the most expert pediatric endocrinologists of the world would be able to identify only approximately 10% of neonates who have congenital hypothyroidism within this window of opportunity of 14 days. What it implies is that if you want to start the treatment at the right time, we should do a screening for congenital hypothyroidism, implying that every child who is born should undergo a thyroid function test right at birth. Once a child comes out from the secure environment of the mother, it faces a lot of challenges, and one of the most important challenge here is the temperature challenge. So baby has been growing very well in the warm environment inside the uterus. Suddenly they're exposed to a lot of cold stress, and the most important parameter which will decide the survival of the baby is how would they be able to fight this cold stress. The most important process of countering the cold stress is to increase the metabolism, and thyroid is the major regulator of metabolism. So every newborn when they are born will see a sudden rise in thyroid hormone, including the hypothalamic thyrotropin releasing hormone, the pituitary thyroid stimulating hormone, and the thyroid gland which produces T3 and T4 hormones. These levels will go really high in the first 24 hours, will gradually start to come down and settle by around 3 weeks of life. The levels are so high in the first 3 days of life that we would not be able to interpret those results if the tests are done in that period. Therefore, the neonatal screening for congenital hypothyroidism should ideally be done after 3 days or 72 hours of life. The thyroid hormone levels, especially the TSH levels of the newborns, are quite different from those which are reported in the ranges, the reference ranges, or the adult reference range. Therefore, it is very, very important to look into the timing of the test while interpreting these TSH levels. So, the levels which will be high for an adult may be normal for a neonate. Therefore, somebody who has a TSH level which is more than 40 at day 3, 20 at day 7, and more than 10 beyond 14 days of life would require further evaluation and management. Therefore, it's absolutely essential to contact your doctor if the neonatal screening reports of your child shows high TSH. It may not really be that high to merit treatment. Whenever we go and meet a newborn, whenever somebody is born in your family, the first question that you should ask from that family is whether a thyroid function test has been done or not, and if yes, have the reports been collected, and if it's abnormal, have you consulted the doctor. If we do a neonatal screening for thyroid disorders, we will be able to help a large number of newborns